Hi, everybody. We are going to go ahead and get started. I want to welcome everybody to this seventh meeting of CSG's National Long-Term Care Workforce Network. I'm Sean Sloan. I'm a senior policy analyst at the Council of State Governments here at the national headquarters in Lexington, Kentucky. Here is our agenda for today. After a quick introduction and project recap from me, we will introduce you to our three presenters. We're going to hear first from Natasha Bryant, who is Senior Director of Workforce Research and Development at the Leading Age LTSS Center at UMass Boston. We will hear about the WIS Caregiver Careers Certified Direct Care Professional Program from Kevin Coughlin, who is Policy Initiatives Advisor at the Wisconsin Department of Health Services. And we'll hear about an action plan to expand career pathways for certified nursing assistants from Betsy White, Assistant Professor of Health Services, Policy and Practice at Brown University's School of Public Health and a member of the Moving Forward Coalition's Workforce-Focused Committee. We encourage you to make extensive use of the Q&A and chat functions here in Zoom to submit any questions and comments, which we will turn to in the last part of the program. Please stick around until the end, and I'll have a few announcements about upcoming meetings and other activities. So just a quick project recap. Last year, with the support of the Commonwealth Fund, CSG put together an 8-state interbranch task force of state policymakers that convened multiple times over the course of the year and advised us as we put together the CSG Long-Term Care Policy Guide, which you will find on the CSG website. One of the three focus areas we had for the project was revitalizing the direct care workforce and supporting family caregivers. And in the policy guide, you'll find a number of strategies states have deployed to address those issues in recent years. We are pleased to again be working on this project with the Commonwealth Fund to build on the work we did last year. By joining us today or for past or future meetings, you are all members of our National Long-Term Care Workforce Network, an expanded version of last year's 8-state task force that now includes not only state policymakers, but a variety of subject matter experts, stakeholder groups, and other partners. We're developing a new website, a national online resource center that we hope will be ready to go next month and become a clearinghouse for all of the relevant work being done on long-term care workforce policy around the country. We hope our network members will share relevant legislation, policy reports, and other materials that we can post to the website or link to. With this project, we also have the opportunity to provide on-site technical assistance services for up to 5 states. If you believe policymakers in your state could benefit from a detailed briefing and action planning session on how they might move forward with policies to address long-term care workforce needs, please get in touch. So without further ado, we want to dive into our main topic of this meeting, which is expanding career pathways for long-term care workers. Natasha Bryant is joining us. She is Senior Director of Workforce Research and Development at the Leading Age LTSS Center at UMass Boston, but in their Washington, D.C. office, which is very confusing, but that was very convenient for our purposes when she was able to join us last week for one of our Medicaid Policy Academies in Virginia. Her work focuses on developing, testing, and disseminating workforce improvement initiatives to attract and retain quality staff at all levels of aging services organizations. Bryant helped the Leading Age Workforce Cabinet develop core competencies and behavioral standards for personal care attendants and mid-level managers. She also managed a national initiative to improve the recruitment and retention of direct care workers. And as I told her the other day, as I was writing our long-term care policy guide last year, one of the great reports I relied on was one that she co-authored a couple of years ago called Feeling Valued Because They Are Valued, a vision for professionalizing the caregiving workforce in the field of long-term services and supports. That's a super long title, but that's really an essential part of what we're talking about today, I think. Natasha Bryant, thank you so much for your work and for joining us today.
Thank you, Sean. Thank you for the opportunity to talk about the direct care professional workforce and really seeing career mobility and career advancement opportunities as one solution to really improving the recruitment and the retention of this workforce. Next slide, please. So as many of you know, America is aging. We see over between 2010 and 2050, the number of older adults, people who are 65 and older, will really double from 40.2 million to 88.5 million. And so they'll increase from about 13% of the total US population to 22%. When we look at those folks who are 85 and older, we see that that group will increase from 5.8 million in 2010 to nearly triple to 19 million in 2015. So this population is growing faster than any other age group and is the ones that are most likely to need long-term services and supports. Next slide. So the direct care workers are the people who really provide the majority of care to older adults and people with disabilities and help them with their activities of daily living and instrumental activities of daily living. They work in a variety of settings, including nursing homes, assisted living, other residential care communities, and in the home. And they're your certified nursing assistants, home health aide, and home care and personal care aide. And data from PHI kind of paints a picture and snapshot of who are these direct care workers. We see most of them are women and a median age of 43. And this workforce is very diverse and more so than the US labor force. 62% are people of color compared to about 40% of the US labor force, and 28% are foreign-born workers compared to about 17% in the US labor force. Looking at the salaries, there has been an increase in their salaries over the last 10 years. Back in 2012, the average salary was about $13.43 an hour, and that has increased to $15.43 median hourly wage in 2022. However, a lot of this was because of COVID-19 pandemic funding measures, and these are beginning to slow down, and we're seeing some reversals as these money are no longer continuing. 38% work part-time, and because of the low wages and part-time work, we see that their annual salary is about $23,700. And the low income also leads to poverty. 13% of direct care professionals live in households that are below the federal poverty level, and 39% are in low-income households. And I should mention that we have about 4.8 million direct care workers currently in the workforce. And we've added nearly 1.6 million jobs from 2012. Next slide, please. So one of the challenges is we have a workforce shortage of direct care professionals, and this is even worse in rural areas. Again, data from PHI shows us between 2021 and 2031, there'll be 7.4 million job openings among direct care professionals who work in home care, residential care, and as well as nursing homes. And this is due to demand and increased need for the services, which accounts for about 1 million of those jobs. But bigger than that is it's because people are either leaving the workforce or leaving their aging services sector, which is about 3.4 million. At the same time, we have insufficient number of caregivers. When you're looking at the caregiver support ratio, which is really the ratio of people who need care to those who are of caregiving age, that we're seeing in 2016, we had about 31 people of caregiving age for every adult 85 and older. And by 2060, that number is going to decrease to just 12 people of working age. And so really, we have a problem that we don't have the people we need to care for folks who need these services. And this leads to service access problems for consumers, extreme workloads for the incumbent workers. We also, if we don't have sufficient number of workers and they don't have the proper training, this can be related to poor quality outcomes, as well as a limited pipeline. So the future will really look worse if we don't come up with some serious interventions. Next slide, please. So what are the reasons for our workforce challenge? One is we have a lack of quality supervisors. We find that a lot of the nurse supervisors in long-term care get the technical skills training, but they don't have the coaching and supervision and mentoring. And one of the main reasons that people leave the workforce is because of their supervisor. As I mentioned, inadequate compensation and benefits. People aren't getting a living wage, and a lot of them are living in low-income households. We also have a lack of standardized competency-based training. So the certified nursing assistants and the certified home health aides federally are required to have a minimum of 75 hours of training. However, when you look at the home care aide workforce, there is no federal training requirements, and it's really based on each state. So one of the things we've looked at Leading Age is thinking about having a national competency-based training standard. And this would really be a national standard of training for all workers, regardless of what setting they're in, and that would also be portable across states. And this would really help increase the competencies and the training standards for all workers. And it would also allow workers that when there's not enough in one setting could move into another setting. For example, during COVID-19 pandemic, we found that some clients in home care were stopping services, and we would have been able to deploy those home care aides into the nursing home setting. There's inadequate inboarding and in-service training, poor working conditions and job design. Long-term care is really a flat organization, and so there's a lack of career mobility, which I'm going to talk about a little bit later, and as well as inadequate public reimbursement to really provide a living wage for these workers. Next slide, please. So as I mentioned, we really need to attract more people to the field and give them a reason to stay. And a lack of meaningful career advancement opportunities is one of the impediments, and it contributes to poor job quality. This gap is preventing workers from expanding their skills, growing their paychecks, as well as taking on increased responsibility. And there's a significant need to develop career ladders and lattices that are accessible to direct care professionals and that can really build on their existing experiences. So I want to talk today about some strategies that can be implemented to really elevate the role of direct care professionals, develop advanced roles for experienced workers, and really thinking about how we provide additional support and compensation to reflect direct care professionals' enhanced responsibilities. And this is a way to really maximize their contribution to the care quality and outcomes. Next slide. So first I want to talk about career lattices. Not all staff want to advance up a career ladder, but this doesn't mean they don't want to grow in their profession. And so, as I mentioned, they really deserve to develop expertise, try new things, and also develop new skills. Career lattices are internal training processes that really upskill or advance caregivers' professional scope of expertise within a given role. And these career lattices could include badges or micro-credentials that recognizes these new training and skill sets that these workers obtain. So one thing to think about are having direct care professionals be condition-specific specialists. They could specialize in dementia care, chronic condition management, behavioral health, and medication and pain management, just to name a few. And this would be giving them additional training to really support people with these different types of conditions. One of the things that employers would need to think about is how do we develop some competency-based descriptions, job descriptions that really utilize these skill sets, and also having the educational institutions that can create the opportunities for these training programs that really match the skill sets of the direct care professionals. Also looking at peer mentorship. A peer mentorship model really trains experienced direct care professionals in coaching and problem-solving competencies so that they can serve as peer support mentors who really can support new workers, really helping them navigate the challenges in caregiving and other issues as they transition into the direct care work. Peer mentors may even go into the field to support the mentees on the job. One of the things we find that a lot of the turnover that occurs in aging services is during those first 3 months on the job, and this person can really support and guide that new hire. Peer mentors can sometimes have that as their only job, but we've also seen where they serve in advanced role as a peer mentor as they continue to do their work either as a home care worker or as a nursing assistant. And some pilot programs and different programs have shown that these peer mentorship programs are associated with increased retention rates among the workforce and those who are receiving those peer mentoring support. Also thinking about advanced roles and really integrating home care aides and nursing assistant into team-based care, that they're working with those clinicians and other team members who are supporting that individual. And what we would see is that we'd really provide these aides some training on how to observe the care recipient, how to document the person's health status and the care that's being provided to them, and really being able to communicate effectively with other members of the care team. So one of the things to consider are the Nurse Practice Acts. Many efforts to maximize the role of direct care professionals through upskilling and advanced role development cover topics and functions that really fall within a worker's state-specific job descriptions. However, in some cases, amendments to Nurse Practice Acts are required to allow advanced aid to complete previously restricted tasks through nurse delegation. Sometimes it can be difficult to get these amendments passed because there are concerns among certain stakeholder groups about changes in direct care workers' role impacting nurses' scope of practices and consumers' quality of care. However, we've seen in some studies, while there have been limited studies, that having these aides have an enhanced delegation doesn't impact the quality of care. In fact, there was one pilot done in New Jersey years ago where home health aides received enhanced delegation to administer medications, and they found no adverse outcomes and documented a range of positive impacts on consumers and the workers themselves. If nurse delegation changes are implemented with appropriate training and supervision, they can safely administer and meet the care needs and really help maximize, again, that direct care professional's contribution to care quality outcomes. Next slide. I just wanted to provide a couple examples of some advanced roles and enhanced positions for the direct care professionals. One is the Massachusetts Supportive Home Care Aid Program. And these were where aides specialize in caring for individuals with mental health conditions or Alzheimer's disease or other forms of dementia. These aides then receive an additional 12 hours of training to really be specialists in these different areas. They get very advanced supervision, and the supervisors also take 3 hours of training to be in these roles as a supervisor and really to complement the competencies of these aides. They are integrated into the care teams by participating in quarterly team meetings where they get some further training, group supervision, and case reviews, and where they can give their input in what they're seeing going on with that client that they're taking care of. And this also helps to ensure that these aides are continuously supported and upskilled over time. Next slide. Another program is Trinity Health Senior Communities. Sometimes the transition for patients who are going through rehab from a hospital to a nursing home and then back to the home can be stressful, and the patients may struggle to understand their treatment regimens. So Trinity Health Senior Communities piloted a program back in 2017 to train and deploy 12 CNAs as transition specialists who would really support the rehab patients through that process. Trinity was awarded a $1.5 million grant from the state of Michigan, where they had these skilled nursing facilities, and they piloted the program. So the CNAs participated in a 1-week training program to help them understand and report changes in 3 common chronic conditions among older adults: those with heart failure, diabetes, and chronic obstructive pulmonary disease. And they would also receive training on really learning effective communication approaches to talk with not only the family caregivers and the patients, but with other members of the care team. The transition specialist will work with the admission staff to really understand the prognosis of those clients, as well as the discharge instructions. They work with the rehab patients when they're discharged to the nursing home to really understand what are their needs and what their mental and emotional state is, as well as work with them 30 days after they go back to the home to really support that individuals. They also collaborate, as I mentioned, with other members of the care team and interact with other family members. These aides earn $3 per hour more than other CNAs, which added an additional $5,000 to their annual income. And an external valuation found that this program led to lower hospital readmission rates and greater rehabilitation patient satisfaction. And the last program I want to highlight is the Homebridge STEPS program, which is Skills Training and Employment Pathways program. And this is really an opportunity for home care aides to grow professionally and earn pay raises within the home care professional track. Previously, before this program, program, all the Homebridge care aides receive the same training and pay, regardless of whether they've been working there for a few months or for many years. And what Homebridge did is they did two things. One, they increased the starting wage to $16 an hour. And they also developed a 3-tier training program that covered basic home care, substance use and mental health, and medical skills. At each step, workers got a new title, more responsibility, and a 50 cents per hour raise. And an evaluation of their program found that there was improved retention, improved job satisfaction among the aides. It was easier to recruit new aides into the agency. And they also found reduced emergency visits, room visits for their patients. Next slide. So also we need to think about career ladders, where these are formal advancements that result in a new role, title, degree, or certification. The jobs have to be there, and providers have to pay for the enhancements as the workers go up the ladder. Typically, what we find in a career ladder is down a nursing path, where personal care aide may move to a certified nursing assistant or home health aide, and then get their LPN and then get their RN degree. But we also need to think about alternative pathways. In some of our work and discussions with direct care professionals, we've heard that not all of them want to become nurses, and are there other advancement and career ladders that can be a possibility for them. So at Leading Age LTSS Center, we are working on an initiative with social work schools and other stakeholders to develop a career pathways for direct care professionals to become social workers, and really thinking about opportunities for incremental advancement that leverage the relationship skills of these workers. So these positions can include care managers, service coordinators, behavioral health specialists, or social work assistants, for some examples. And the incremental advancement allows for a career endpoint for those who do not wish to pursue a 4-year degree, but it also gives options for those while they're pursuing their social work degree. And this really helps address the workforce gap of social workers with an interest in aging services. It expands the behavioral health and psychosocial skills of providers by allowing a position of a lower credential to take on some of the work of the social worker, so that the social worker has more time to meet the needs of residents, as well as looking to retain the direct care professionals in the field. We're bringing together different stakeholder groups to really think about how we would develop this pathway and answer questions such as, how do we work with providers to create the jobs along the pathway? How do we get funds to compensate employees for their newly earned qualification? And also thinking about, how do we address the fear that aides with advanced credentials would leave the organizations that encourage their growth? So we're hoping to work with these different stakeholder groups to develop this. Next slide. So building career lattices and ladders for direct care professionals is just one solution to help improve the recruitment and retention, as well as improve care delivery and outcomes. This is obviously a multifaceted solution that we need, and career mobility is just one option. Success of these efforts rely on several elements. One is having effective training and supervision to make sure that the workers have the baseline competencies and they have sufficient ongoing information, support, and oversight to really fulfill their roles effectively. We need to make sure the workers have the authorization to perform the specialized or advanced tasks. This may be either through organization or public policy changes, and that looking to have these policies standardized across settings and state to really help prevent gaps and inefficiencies in care. Thinking about really having formal structures to facilitate communication between direct care professionals and the clinical team members. Often in home care, some of these direct care workers are alone in the client's home and don't see other members of the care team. So how can we get that communication going? Because these are the people who really are the eyes and ears and can notice subtle changes in those clients. Also about sustainable funding to cover the cost of training and compensation for direct care professionals who develop their skills and take on new roles and responsibilities. Otherwise, employers may not be able to invest in enhanced training and advanced roles. And there have been numerous advanced roles that have been implemented across the country, primarily in individual providers or provider groups. And oftentimes these are grant-funded programs that may cease once the funding ends. We have seen in the research that pilot programs to create career lattice opportunities, particularly among the home care workforce have shown some preliminary positive outcomes. However, we still need rigorous evaluations to determine the impact. So thinking about how can we scale up and test advanced roles for direct care professionals to really demonstrate the impact on care, quality, cost, and workforce recruitment and retention. And thinking about implementing some of these promising examples as on a larger scale in order to make an evidence-based case for sustained investment. Thank you.
Natasha, thank you so much for that presentation. As usual, we will reserve questions until the end of the hour, so please stay with us. If you do have a question, you can submit it in the Q&A here on Zoom at any time, and we will ask as many as time allows. And Natasha, feel free to take a peek and join the conversation in there if there's anything to respond to quickly or anything we should bring to the attention of the full group as we move along here. So right now I want to welcome Kevin Coughlin. His title is Policy Initiative Advisor Executive in the Division of Medicaid Services at the Wisconsin Department of Health Services. He's going to tell us about Wisconsin's Certified Direct Care Professional Program. Kevin, thank you so much for joining us.
Thank you, Sean. Really honored to be here talking about this important issue. You can advance the next slide. So as you know, Wisconsin's not unique in the crisis that we're dealing with, as Natasha really summarized so well. We really, in all of our programs, we depend on caregivers to really deliver the services that we need. Next. So we're using both Money Follows the Person and ARPA HCBS funding to really take a multifaceted approach to attacking this issue. You know, I think we learned, we participated in the 2021 CMS Direct Service Workforce Learning Collaborative. We also worked closely with PHI. We did our own research, and then we had a series of listening sessions with stakeholders, including direct care workers. So we learned so much, and I think we kept hearing that we need to address this by really a multifaceted approach. Next. So our first prong of this process is we started participating in the State of the Workforce surveys done by the National Core Indicators. So for the first time, Wisconsin participated in the survey for individuals with intellectual and developmental disabilities. Next slide. And then we also participated in a pilot for for aging and people with physical disabilities. So we wanted to do this so that we can really find out kind of where we sit, you know, what is our benchmarks, and then can we see any differences as we start implementing these programs. So this data at a glance just kind of tells us we are not leading the nation in these areas. So in many cases, we're kind of middle of the pack, and we need to improve this. So I think it's going to really motivate us to attack these issues and to see if we're making any changes. So we're going to participate in this every 2 years. We're kind of weighing the balance of both the burden on the provider to get this information to us, but the need for this data as well. So one of the things, next slide, please, we did hear about was we had our own questions, and one of these was, what do you need to strengthen and build your own direct care workforce? And the top 3 answers are actually things that we are now are part of our initiative to address the workforce crisis with standardized training, recruitment tools, and retention tools. So that was nice to hear that we're kind of on track with the things that we wanted to participate in. Next. So our second prong is what we did is we created a direct care professional certification. So it's a 3-year certification, and the curriculum includes 14 different competencies that we learned through our research and working with key stakeholders. And then one of the interesting things too that I'm really proud of is that in our listening sessions with caregivers, we asked them what they wanted as this title, and they were the ones that chose this title, and they felt strongly that they wanted that word professional in their title. And, you know, I think some of the things that Sean talked about and that Natasha, the paper about feeling valued, that's something that we heard, that they didn't feel like they were valued, and they didn't feel appreciated for the hard work that they're doing. So we created this certification, and it's 30 hours on demand online, and they can do it in small modules to get through it. It's free, and it's similar to a certified nursing assistant, where it's they get a 3-year renewal. And then the other important thing is we will have a Spanish version of this curriculum in the next couple months, and then by next year also Hmong, which is another population in Wisconsin that we want to make sure that we're addressing. Next, please. So a third prong, and something that Natasha talked about, was micro-credentialing and badging. So we found, you know, when we were developing the curriculum, we knew that we can't possibly train everything. And there's some really good training out there that we could leverage. So the idea is to have these micro credentials that we can connect to with our certification. And then, so for example, a person might have their certified direct care professional certification, and then be badged in dementia care, specialized challenging behaviors in dementia, things like that. And that will show up as a virtual badge on their registry and on another aspect that I'm going to be talking about soon with our IT portal. Next. So the next please. The next is that IT portal, which is sort of our fourth prong attacking this issue, and it's called WIS Caregiver Connections. So we rebranded it with our WIS Caregiver Careers logo and branding, and it has all of these features to help connect our employers and our job seekers. So as these people come out of their training, they get certified with their proctored exam, and they're on the registry, and then they will have access to this platform so that they can start looking for employers, and then the employers are going to be able to find them as well. We're also going to use this program to really provide support and resources for both the job seekers and the employers. Next. So the fifth prong is really to offer this for free. So we have both ARPA and MFP funding to certify 10,000 individuals, and then they will also receive directly in the mail a $250 sign-on or stay-on bonus, and a $250 retention bonus if they work in a eligible home and community-based service provider. Next. And then our sixth prong is we have a comprehensive marketing plan that to recruit these new and existing caregivers to sign up and become certified direct care professionals. So we're using all kinds of different methods, and we have some very good early results already. Again, similar to what Natasha was talking about, we are spending a lot of time looking at ladders and lattices. So our seventh prong, I think we heard loud and clear from our direct care workers that they want career pathways. Some of them don't. Some of them want to stay direct care workers, but also they want to have that recognition and more training. So we are looking at both those ladders and those lattices. We're working with our sister division that licenses and regulates a lot of assisted living and personal care agencies, and we're using that to have to look across, how can we be waived from certain trainings? So allowing really breaking down barriers for people to be able to work across different settings. And then we're working with our schools, our Department of Workforce Development, and our Department of Public Instruction to get this into high schools. And we are already on sort of this regional career pathway, so that this is an option for high school students as they come into, as they're looking for more of a healthcare career. So we're real excited about some of the programs that we're doing there. So next. Okay, I'm sorry, I was ahead a little bit. Go one more. Thanks. And then another thing that we're doing is we had ARPA funding for innovation grants. And so another prong of this process is we use $30 million and issued 158 awards across Wisconsin to improve our home and community-based services. And as you can see by this little dashboard, many of those dealt with workforce issues. So we had 89 and 20 million of that funding was to address workforce issues. And two grants, if you have an opportunity, this Capri Community, they're doing a 4 for 5 pilot. So people are working 4 days, getting paid for 5, with some really awesome, encouraging early results. And then also another one where we have a home and community-based manager certificate. So kind of that ladder that they don't want to go clinically, they want to become more in the management supervision. And that's seen against also some great early success. Next. So our ninth and final prong is really sustainability. How do we keep this thing going? So we are including this in our CMS waiver renewal. We're hoping that we have some great stories and data. We're going to be rich in data, and we're going to try to make this part of our biennial budget request so that this can be continued. The pipeline can continue going for many years to come. So speaking of our pipeline, so we just launched July 17th, so we're just 2 months old, and we have go to the next one, please. I think I'm one behind you. So we launched 7/17, and our early results are we have 2,700 individuals that have registered to become certified direct care professionals. More than half of those have sort of taken the next step, which is to enroll in our University of Wisconsin Green Bay training module to get into that system. They're our academic partners. And then over 800 have started the program, so they've completed some of the modules. And then we have 100 that have completed all the modules, and 41 have completed their test and are now part of are on the registry. 59 are waiting for their test to be scheduled, so that should happen soon as well. And then of those 41, 35 are employed. So 6 are looking for jobs yet. So I think early on, just that short a time in, we're really happy with those results. And then we have 438 people that have sort of registered for the employer to find these employees, and 121 have sort of created that their profiles. And this is next, please. And so this is the one about the employer pipeline. And then next, and if you can click that, Sean. So here are some of the things that students are saying about the program. They're required, before they can take their test, they have to do a short little survey, and here are some of the comments. So next, if you can just kind of scroll through these next 4 or 5 quotes. We're really happy to see what these people are saying about the training. I think of those 100 people that have completed the training, all of them, I think there was one that had some constructive criticism on one of the modules, but otherwise it's really been a positive responses. So next. So here's just some write-ups that we've received with this program. And then next are some resources, and I will hopefully, if you have some questions in the Q&A, I'll try to answer those. Thank you very much, Sean.
Kevin, thank you so much. And please get your questions ready for Kevin. Add them in the Q&A. We will ask as many as time allows at the end. And right now, I want to introduce Betsy White. She is Assistant Professor of Health Services, Policy and Practice at Brown University School of Public Health. She is also a member of the Moving Forward Coalition's a workforce-focused committee and their CNA Career Pathway Work Group. If you have been with us since our first network meetings this spring, you may recall we had Alice Bonner and others join us from Moving Forward. This July, the coalition issued a series of action plans, including one focused on expanding career pathways for certified nursing assistants using the Federal Registered Apprenticeship Program framework. And we've invited Betsy to join us to give us the details on that and how the implementation of the plan may proceed. Betsy, take it away.
Thanks, happy to be here. So I know that Alice Bonner had presented to this group previously, so I'll just do a brief recap of what the Moving Forward Coalition is. Next slide, please. So Moving Forward Coalition was convened in order to respond to the NASEM report that came out with recommendations on how to improve nursing home care. We're funding through the John Hartford Foundation. And next slide. And basically what the coalition is it's a group of individuals and organizations with, diverse prospective stakeholders that are coming together and really focused on actionable improvements in nursing homes. So we're kind of taking the recommendations out of the NASEM report and we're trying to develop action plans and actually implement and change. So next slide. So this has kind of been the process with the Moving Forward Coalition. Initially, we were just kind of convening stakeholders, talking about what some of the key priorities out of the NASEM report were to address. And then, over last summer, we wrote a series of action plans. The work group that I co-lead, specifically focused on CNA career pathways. And now we're in implementation phase right now and really growing and, strengthening the relationships we need to make this work. Next slide. So now I will talk just, through some of the specifics of our action plan. It's available on our website here. The link here is down below. So the key thing here is that, CNAs are the bulk of the nursing home workforce, but they're often underappreciated, undercompensated, and they have limited opportunities for career advancement. I'm going to be saying many of the same things that Natasha and Kevin said previously. So as a coalition, we're really looking to develop and pilot a standardized, underlining the word standardized there, CNA career pathway model under the Registered Apprenticeship Program framework. And I'm going to be using the terminology career pathways. What we're really talking about, just to echo the language that Natasha and Kevin were using, is we're talking about a career lattice. So supporting advancement of CNAs within the CNA role. Next slide. So, again, echoing from the previous speakers, CNAs are the core of the nursing home workforce, and they don't have enough opportunities for advancement. They often feel underprepared and underappreciated, and, they're being expected to care for an increasingly complex population. And what happens is when you bring people into a job where they don't feel prepared and where, they're not paid well and they don't have sufficient opportunities for growth, then they experience job dissatisfaction, they experience burnout, and these are major factors contributing to turnover. And when you have staff leaving, that further exacerbates staff shortages, which further exacerbates job dissatisfaction and burnout. And this is just this perpetual cycle. So we really feel, and again, to echo the earlier points, that having opportunities for career advancement for CNAs are really critical, both to support recruitment and retention. Next slide. So one of the key partners on our work groups initiative has been NACA, the National CNA Association. If you haven't partnered with them in your state before, you should. They are a very important partner. And they did a survey of CNAs just in July. There were about 1,400 nursing home CNAs who responded. These are some of kind of the key questions they asked. So they asked, what are the key things, if you were to leave or thought about leaving the CNA profession altogether, what would it take to bring you back? And not surprising to anybody, wages and benefits, top priority here, but also things like scheduling flexibility, safe staffing. And also, over 40% of CNAs were saying that they need better training and opportunities for career advancement. So next slide. Another key question from the NACA survey is, You know, do you want to continue your career as a CNA if you were able to get additional education, wage increases, and recognition? And you can see overwhelmingly here that most of the people who decide to become a CNA want to be a CNA. And that's a really important point, because I think too often we get lost in the narrative, and, you know, we sometimes talk about this as being a dispensable workforce, and, well, a CNA, they can go work at Amazon or go work in retail or whatnot. And, I think it's really important to understand this, that people who become CNAs, they want to be CNAs, they want to take care of people, and we really need to recognize that and value their work. Next slide. And then a final key question out of the NACA survey, they asked, what areas of education interest you? Do you feel that you need more education? And you can see dementia care, end-of-life care, and infection control were kind of the top ones that raised on the list here. And this is similar to other pathway models that we have heard out there. These are kind of common topics that are integrated into those models. Next slide. So as part of our action plan, we initially did a scoping review just to understand, what kinds of models are already out there. Natasha was talking about a couple of them. I think the biggest key takeaway I can give here is, what we've learned is that these types of initiatives tend to be, there's a pilot over here, a pilot here, a pilot here, a pilot here. They tend to be very time limited, scope limited, small in scale, and really have issues with growth and sustainability. So key takeaway there: huge heterogeneity, tend to be small scale, one-off initiatives. However, there are a number of similarities. As I mentioned, dementia, behavioral health, end-of-life care, these are frequent areas of education that are integrated into these types of models. Also restorative nursing, leadership skills. Almost all the models come with some form of wage progression, which we feel is very important to, as Natasha mentioned, reward the progression and the additional skills and knowledge that the CNA is acquiring as they go through a pathway model. And generally, they're very well received among those who are directly involved. Now, differences. There's all sorts of different, tiers and credentials, micro-credentials, badges that people receive. Again, significant variation, heterogeneity there. Some are done under the registered apprenticeship framework, some are not, and I'll talk in a minute a little bit more about registered apprenticeship specifically. Lots of variation in funding sources. Again, another common theme here is they tend to be very grant-based, and once a grant finishes, that impacts sustainability of a model. Some models include a path to another certification or licensure, so this would be more of a career ladder, either supporting them to go, become an LPN, an RN, or a med tech. Others, are more in kind of the micro-credential badge career lattice department. Next slide. So the other, just to kind of put the various pathway models that are out there into different buckets, this is kind of what we, the three main categories that we've learned about. So first, there's a category of registered apprenticeships that train individuals to CNA certification. So they bring people in, they support them to become a CNA. Oftentimes we'll provide wraparound services and mentorship to support that transition. Probably the best example of this and the most replicable example of this is the SEIU CNA apprenticeship programs done through their training and employment funds. It's a replicable model that they have implemented in multiple states. Another kind of bucket that we've learned about are career pathways for existing CNAs. So this is someone who already has the CNA certification, and it's done outside of the registered apprenticeship framework. A key model for this would be a pilot that's currently underway in California with the California American Healthcare Association and their educational foundation, along with NACA, the National Association for CNAs. They're partnering together, and I see Claire Enright on the call, who she has led that initiative out in California. And that particular model has been very informative as we've been thinking about this as a coalition. The final kind of bucket of models that we've learned about are career pathways for existing CNAs. Again, the starting point is you're already a CNA, and it's done under the framework of the Registered Apprenticeship Program. An example of this would be Leading Age Minnesota had a a CNA, advanced CNA apprenticeship program that they led for a number of years. Next slide. So why? So we're proposing as a coalition, we're proposing a registered CNA pathway as part of a registered apprenticeship. And why are we focused on apprenticeship? So apprenticeship is a nationally recognized portable credential. Again, as I mentioned, and we've heard before, lots of variation, issues with portability and sustainability. The registered apprenticeship program puts some structure around this. It allows for development of national standards that can then be replicated by other employers. Replication allows for evaluation. When you have lots of variation in one-off programs, it makes it difficult to develop an evidence base that supports sustainability and replicability. So that's a key part of our program as well, is developing an evaluation plan. And also apprenticeship allows access to resources and funding sources specific to apprenticeship. There's been a lot of federal and state investment in apprenticeship in the last few years, including the federal U.S. Department of Labor contracting with industry intermediaries to support the administrative and technical aspects of apprenticeship for employers. Next slide. So in a nutshell, our proposal, we are looking to develop a national registered apprenticeship standard for a CNA pathway, and we're really trying to build this to design it to be replicable. We're looking to build the pathway with existing educational resources from NACA. NACA has invested a lot in building out educational models for CNAs, and they've built them by CNAs for CNAs, so we're trying to leverage those resources. Also, the Geriatrics Workforce Enhancement Programs, they currently receive funding through HRSA to support education in nursing homes. We're trying to leverage these resources that are already out there. We're looking to collaborate with the American Healthcare Association and leading age state affiliates. We're in discussions with 2 states right now, and we're building those relationships and to try to put a pilot together. We're partnering with an industry intermediary to coordinate the administrative and regulatory aspects of this. And then we're leveraging the platform of the Moving Forward Coalition to promote and disseminate this, and then we'll have an evaluation plan as part of this as well. Next slide. So this is the kind of the draft pathway that we're talking about right now. I know we're a little limited on time, so I'm not going to go too far into detail on this, other than to say that this is adapted from the pilot that, as I mentioned, the California ACA Association and NACA have partnered with together. So we're kind of building this to be a national standard, but also have some flexibility in it so we can adapt it within states. We have designed this as a 2-year, 4-tier model, 6 months within each tier, and it would come with a wage progression. And again, the entry point for this are CNAs who have been employed at least 6 months. Next slide. Actually, one more slide. Let me just kind of get to the key points, so we do have a couple minutes for questions. So, these kinds of initiatives, what are some of the key points in terms of how states can help to support them? So first and foremost is helping to develop sustainable funding models. The current landscape for CNA workforce development is highly dependent on state and regional grants. Lots of variation. These tend to be very time-limited, scope-limited grants, and when a grant finishes, then that limits sustainability. And Matt Cantrell, who has been one of the key partners with NACA, he said to us, listen, we just go from one grant to the next, and that has been, really a key source of frustration. So as much as states can help to develop more sustainable funding models, really important. Also, when grants are made available, reduce the administrative burden, publish requests for applications, well in advance, have them all in a centralized location, allow rolling applications, reduce unnecessary paperwork. Oftentimes, we hear about grants that are published and, there's a very short time frame to apply for them. And, when you have employers that are already strapped with multiple other things that they have to manage, putting in a complex grant application can be really challenging. Another key recommendation is to improve integration across state agencies. So in some states, CNAs fall under the purview of departments of health. Other states, it's boards of nursing. Whatever agencies within a state touch, workforce investment for CNAs. Just really important to, improve communication and collaboration within the state across agencies and, just reduce a lot of the red tape that comes with, accreditation processes, apprenticeship registration, and all these things. And then finally, next slide. The last thing that I would say is, just partner with the key stakeholders in your state, the Leading Age, the AHCA, and Cal State affiliates. Those are the key representation for nursing home employers. Really important to engage with them, engaging with NAHCA, with SEIU, with the unions, educator partners, the geriatric workforce enhancement programs, who again, they receive HRSA funding to provide education in nursing homes, really important partner. The QIOs, the industry intermediaries. The more that we've gotten into this, we've learned that there are just so many people already in this space, and we just, a lot of resources that we can leverage and just kind of improve collaboration. And then finally, just to echo the other point, we can put as many resources that we want into bringing people into the pipeline, but if we're not really investing in and putting resources towards retention, then, a CNA comes into a job, they get stressed out, they get burned out, and they leave shortly after. So, really important here to just, shift the language. So we're talking about retention, retention, retention. So with that, thank you, and look forward to any questions.
Betsy, thank you so much. And we do want to turn now to questions for all three of our presenters this afternoon. As always, you can type your question into Zoom. I know that Natasha and Kevin have been working in the Q&A to respond to some of the questions that we've already received. Are there any that you think should be brought to the attention of the full group here?
This is Betsy. I did want to just, because I said I was going to answer it live and then I hit the wrong button, but there was a question here about creating a dementia care micro-credential statewide. I would just point out two states that have done that and two different models. So in North Carolina, they actually have a tiered nurse aid certification, and like tier 2 comes with, is competency based. So they have actually, built that into their certification process for CNAs. Another state model is Florida. Florida mandates it's a certain number of hours of dementia training every year for CNAs. So it's doesn't lead to a new certification, but they have that, dementia certification or dementia education kind of built into their annual mandatory ed.
Great. Let's see. And we just got this question, Betsy, what flexibility will states have in your national competencies in the apprenticeship program?
So one thing about writing national standards is that the standard can be reused as long as there's less than a 20% modification in the standard, and you're actually allowed to write the standard to basically provide options into some of the tiers. So, for example, in a state that has a restorative nurse aid certification, it might make sense to have that be one of the tiers. In other states that don't have that kind of a certification, you might want to sub out something else. So we're planning to write it to, have two of those tiers be flexible and, provide some options that different states can kind of substitute in, so that, people that other employers, organizations that want to use these template down the road are not rewriting this every time.
Okay. Let's see, there's a question here. In states and areas with more cultural diversity, do any of the panelists have experience in addressing intercultural caregiving in training and practice, as this often occurs in the field of direct care?
So this is Kevin. So one thing that we're doing is we are creating curriculum in both Spanish, Hmong.
Oops. Kevin, you muted yourself there, I think.
Sorry. Did you hear anything I said?
The first part of it, yeah.
Okay. So we are creating curriculum in English, Spanish, and Hmong, and then in part of the curriculum, it is kind of working with people of different culture and diversity to really have that person-centered approach, and how to as well as caregivers, co-workers that might be of different culture, and how to really have a better understanding of their culture and how to work directly with them. And another part of it is some of the grants that I talked about, we had a fair amount of grants that that people were creating for that included training, and we're hoping to really connect with those through like a micro credential. And there was some really exciting different training that really talked specifically to your question, Whitney. So, thanks.
And Kevin, there's a question there from our friend Senator Moriwaki in Hawaii, and she's asking if a CNA gets certified, is the employer required to increase compensation? If so, is there prior agreement for the employer to pay the additional amount for additional skills that the CNA has?
Yeah, thanks, Sharon. So for our program, the one that I was talking about, it is not a CNA. So this is a certified direct care professional. And in Wisconsin, there is not a requirement for a certification. So this is a voluntary program that we are trying to get out, and hopefully people will want this training because we think it's really good training. As far as employers required to increase compensation, they're not going to. We don't have that as part of the program. But I think when we have a certification, there's a lot more that we can do with it, because there's a registry. We can validate that a person has the competencies through a proctored exam. So we're the Department of Medicaid Services in our home and community-based services, we can start to explore things like pay for performance, for example, if a managed care organization has a provider network that has people that are certified as a direct care professional. So there's different things that we hope to do in the future now that we have this program established, to help with some of those wage issues that everyone's struggling with.
Great. So folks, we are past our time together, but we want to certainly thank all of our panelists, and we are going to we're going to give you some details about some things that are coming up here. But we want to thank everybody for joining us today. A couple of quick notes before we go. With my spate of recent travel mostly in the rear view, I am working to get a few more meetings of the network under our belts in the coming weeks. I've reached out to several folks about participating in a couple of October meetings here on Zoom, and it looks like plans are coalescing around the date of October 18th at 3 p.m. Eastern Daylight Time for one of those, which is 3 weeks from today. I had the opportunity to connect with several individuals at the HCBS conference in Baltimore last month, and I'm excited to announce that on the 18th, we will hear from some of those folks about workforce initiatives in Arizona, Indiana, and Tennessee. We will share a registration link soon for that, and also keep you posted on future meetings once we have those programs completely nailed down. Don't forget about the CSG National Conference, which will take place December 6th to the 9th in Raleigh, North Carolina. We are planning to highlight the work of the National Long-Term Care Workforce Network during a session on December 7th. Plenty of other great sessions to explore as well. If you or a colleague is currently not on our mailing list but would like to be, please reach out. As always, we welcome your suggestions for future meetings. And yes, we will share the slides from our speakers today, as well as a link to a recording of today's meeting to everyone on the mailing list. So be on the lookout for those. As I mentioned, we are working to develop our National Online Resource Center. We're hoping that will be ready to launch next month. Please send us your relevant bills, reports, resources, articles, and initiatives so we can populate the website with details about what is going on in your states regarding the long-term care workforce. If you would like to request on-site technical assistance services, please get in touch. We can also provide more information on who is eligible to request those services and what those site visit events might look like. Next week, I will be back in our nation's capital for the State Dementia Services Coordinator Summit, hosted by our friends at the Alzheimer's Association, and perhaps I will see some of you there. And one last note before we go. Those who have joined us for a previous meeting may have seen this photo and may have a sense of why this work means so much to me. It was taken by my sister on the joyful day last fall that we were finally able to reunite our parents in the same room at a nursing home about 5 minutes from my house. We recognize just how lucky we were and know that not everyone has that good fortune these days. And we know that they were well taken care of by the great staff at that facility. But we were able to reunite them for what would turn out to be the last few months of their lives. As many of you know, Mom passed away in July. She had frontal lobe dementia. Well, Dad passed away peacefully in his sleep last week during the early hours of Wednesday morning, just 2.5 weeks shy of his 83rd birthday. He had Lewy body dementia. Hopefully they've had a chance to reunite once again wherever they are. Thanks so much again for joining us today and participating in the discussion. We hope to see everybody at our next network meeting or sometime down the road. So long from Lexington.
Are you ready for me to stop the recording, Sean?
Yep, go ahead.